Good afternoon, good morning, good evening, depends on which part of the world you're from. Assalamu alaikum. I'm Dr. Zulkifli Ismail from Malaysia. I'm a pediatrician and a member of the Asian Dengue Voice and Action Group, or ADVA group. Welcome to this fourth ADVA webinar with the title of Strategies for Vector Control, the Wolbachia Story. And today we've got an entomologist from Sri Lanka, we've got a Malaysian Ministry of Health Vector-borne Diseases Sector Director, and we have a speaker from the World Mosquito Program. This, as you know, this is the fourth ADVA webinar series. The first webinar we held was held on the 28th of October last year, and this was done by Professor Cameron Simmons, who also talked about what the Wolbachia story. And then we had the second one in January of this year in managing severely ill dengue patients in both adults and children. And the third one was in March of this year with the impact of COVID on dengue, where we found that in almost every other country, the incidence of dengue was coming down during the COVID pandemic, except for Singapore, which actually went up or detected more. And we then had a big virtual forum on June 13th to 15th of this year. And we, as we know, this session is about vector control in dengue, and one of the strategies is Wolbachia-infected mosquito program. To moderate this session today is Professor Rezeki Hadinegoro from Indonesia, and she's going to be co-moderating with me. And as we know, with regard to the Wolbachia program, it's already being carried out in Brazil, in Colombia, in Thailand, Singapore, Indonesia, Vietnam, China, Australia, Tahiti, and Malaysia. And this data is at 2017 from the Malaysian MOH website. I'm sure there are more countries now, and we may share that at the end of this session.
Thank you. Thank you, Prof. Zul. Good afternoon, of you. Thank you for joining with us in the pre-summit webinar about Decimate dengue. In this afternoon, we have three excellent speakers from Sri Lanka, Malaysia, and Indonesia, as already mentioned by Prof. Zulkifli. And I will introduce the first speaker, will be Ms. Sakunthala. Ms. Sakunthala is working as an entomologist at the National Dengue Control Unit, Ministry of Health in Sri Lanka. She graduated with a Bachelor of Science degree in Zoology from the University of Surjadjaja, Sri Lanka, and gotten his Master in Medical Entomologist and Applied Parasitology from the Open University of Sri Lanka. She is now currently pursuing her PhD in molecular entomology from the Institute of Biochemistry and Molecular Biology from the University of Colombo, Sri Lanka. Her research interests includes dengue vector bionomics, insecticide-resistant monitoring, and mosquito virus surveillance. Ms. Sakunthala co-authors guideline and standard operating procedure as on the Aedes vector surveillance and control for the Sri Lanka National Dengue Control Unit. She was also co-investigators on various research projects, with the most recent pilot implementation of Wolbachia to reduce transmission of dengue and other Aedes transmitted viruses in Colombo. The topic will be presented by Ms. Sakunthala is Wolbachia pilot project in Sri Lanka, an entomologist aspect. Please, Ms. Sakunthala, the time is yours.
And good morning, good afternoon, good evening, all of you in the various country participants are there. Today I would like to present the Wolbachia project in Sri Lanka, entomological aspects. And this presentation comprises a brief overview of the dengue situation in Sri Lanka, currently available national strategies, dengue prevention and control activities, and Wolbachia pilot project implementation activities, and entomological aspects of Wolbachia project. First, we will see change in dengue situation in Sri Lanka. Actually, dengue was first confirmed serologically in 1962 in Sri Lanka, and then the first outbreak was reported in 1965. Then this disease become first reported as a public health problem in Sri Lanka from 1989. Then it became a notifiable disease since 1996. Then since early 2000, progressively large epidemics of dengue have occurred at regular intervals. And we can see in this figure geographic spread and increases in number of dengue cases, infections from 2006 to 2017 in Sri Lanka. And this is the source of this figure. And according to this publication, it mentioned dengue fever cases surged 20-fold between 2000 and 2012, and then increased another 3-fold between 2012 and 2019. Then we can see that how is dengue severe in countries now. Then we will move to the current dengue burden in the country, and this figure shows the number of dengue cases reported from 1989 to 2021. And in the year 2017, the largest epidemic ever in the country was reported with 186,101 cases and with 440 deaths. And this publication mentioned that the dengue incidence increased in 2017 in all districts of Sri Lanka compared to the previous 5 years, and limited virological studies reveal that circulating serotype was the dengue virus type 2, and changes in vector abundance were not predictive of the increase in incidence. At present, dengue is prevalent in many urban and semi-urban areas of Sri Lanka with seasonal and periodic epidemics. Then we will move to the since 2005, there has been a national plan of action for the prevention and control of dengue fever. This is the updated version of the national action plan for dengue prevention and control. And this action plan has been developed under these major strategies. Then we will move to the dengue vector surveillance and control strategies in Sri Lanka. This currently available standard operating procedures provide guidance to conduct these entomological surveillance related to the Aedes surveillance in the country. And this guideline provide guidance to the vector control activities in the country. These are the major activities, identified major activities in Sri Lanka: environment management, chemical control, biological and biochemical method, intersectoral collaboration, health education, and law enforcement. Under this category, under biological and biochemical methods, we use herbivorous fish, BTI, and IGR is used. This Wolbachia method also under this category. Then we will move into the Wolbachia project background informations first. Actually, in initial activities was started in 2017. The letter of intent was signed by Professor Scott O'Neill and the Secretary of Health in 2017. Then after MOU was signed in 2018. These are the research collaboration partners from the Government of Australia, Monash University, WMP, from Government of Sri Lanka, Ministry of Health, and the National Dengue Control Unit. WMP acts as a funding agency and technical supporting agency. The National Dengue Control Unit acts as a local coordination and implementation partner of this project. Other than that, in local partners, Colombo Municipal Council, County Municipal Council act as a local collaborating agencies for this project. And another important thing is that according to the rules and regulations of the government, it has to obtain necessary approval and permits before starting any project. It's a huge challenge for us in that moment. And these are the obtained approval and permits. Actually, the most essential and crucial permission was the release of Wolbachia-infected mosquito, and this approval has been granted by the National Expert Committee on Biological Diversity under the Ministry of Environment. And in 2018, this expert committee has appointed an independent observing committee for the environment risk assessment of this project. And in environment risk assessment activities are being conducted by this committee with the collaboration of the National Dengue Control Unit. Other than that, ED's import and export permits and larval food import permissions were obtained from the necessary relevant authorities. Then we'll see how the capacity building activities of the project staff are carried out during this period. The initial workshop had been conducted by the Eliminate Dengue program, Monash University, Australia in 2017. Then after that, after the study, can you hear me now? Yeah. After that, a study tour had been arranged by the Sri Lanka government for the selected members of the project to gain knowledge on Wolbachia story, success story from the Queensland Health Department. And then this is the study. This is the study then conducted the study tour for the research team. Then after that, the time to time local training arranged by the World Mosquito Program team to improve the capacity building of the project staff. Then we'll see that selected area. According to the considering the dengue incidence and vector distributions of the areas, CMCD1 MOH area. MOH means Medical Office of Health area. It is the smallest health administrative unit of the Sri Lanka, and Nugegode MOH area were selected for this study. This is the area maps. Then let us see project implementation. It is also a huge challenge in this project. There are two types of activities of setup operation. First one is set up the project team. The project teams full-time, part-time basis and temporary staff were recruited for this project staff. And then set up the facilities. It is huge challenge in this project. It is the diagnostic laboratories established at the National Dengue Control premises using 2 container boxes, and this project diagnostic laboratory is used to pursue the establishment of the Wolbachia-infected Aedes aegypti. Then project field office was used on a rental basis only for the project period, and it was used to conduct project meetings, field activity arrangement, capsule preparation, and BG identification. Further, that our NDCU entomology laboratory upgraded by the for this project. Yeah, then important part of this presentation, overview of the entomology aspect of this project. We can divide it into 2 sections, entomology part, field and the laboratory section. First, I will briefly explain what is the laboratory activities, and insecticide resistant testing and backcrossing, colony maintaining rearing, mass egg productions. IR test mean insecticide resistant tests were conducted in Sri Lanka and Australia laboratory both. Backcrossing, I will explain later what is backcrossing and outcrossing. Backcrossing activities, colony maintaining, rearing, these activities were conducted in the Monash University laboratory. Then we will move on to that ovitraps. It is most important field activity in the Wolbachia project. Ovitrap means it's a kind of a bucket containing water, and this you can see that red color strips is there. It's a red color cloth. We use this cloth as a ovi strips. Mosquito come and lay their eggs on this strip. And ovitrap are easy to remove and replace every week. This method is sensitive, economical, and operationally viable. And we'll see why we use ovitraps for Wolbachia project. It is important. And to investigate the distribution of mosquitoes in the release area, we have to know what of mosquitoes prevalent in this study area, and investigate the level of resistance to commonly used insecticide in release area, and create a local release colony by mating Wolbachia females with wild type males, and it can be used as a monitoring tool. Then we will move, I will explain later this ovitrap survey. Then we will move to the BG trap collections. Actually, this trap is superior trap for mosquito surveillance and monitoring. And BG traps are used for monitoring mosquito populations before releasing areas, and they are used to determine the Wolbachia frequency and frequency during and after releasing. Furthermore, this trap is used to monitor the species distribution as well. Then that last field activity is mosquito release. It is the important part of this Wolbachia project. Here the Wolbachia infected both male and female mosquitoes are released, and therefore this method acts as a self-sustaining replacement method. In this figure, you can see after some time period, the Wolbachia infected mosquitoes are the prominent type in the field. Then I will move some highlights of the ovitrap survey to see what is these ovitraps. Ovitraps in actually for this project, we were placed in ovitraps in different areas, different selected areas in the release area. After 3 to 5 days, traps were collected and mosquito eggs positive strips were collected in a proper way. Then after these ovid strips were hatched with water, and the egg, the emerged larvae were sorted, separated the Aedes aegypti larvae. Then they rear up to adult level, then blood fed them and obtained the F1 eggs. Why we use this? What are the purpose of this F1 eggs? Actually, we can use these F1 eggs, rear these eggs, hatch these eggs, and rear adult mosquito, and we can test them for the insecticide resistance. And we need to do the backcrossing to generate the Wolbachia line, so we can export this eggs to the Australia for the backcrossing activities. Then for the outcrossing activities, we can use this eggs. This is the purpose of the ovitrap survey. Summary of the ovitrap survey. Actually, then we'll move why we use that insecticide resistance survey for the Wolbachia project. It is very important thing. Because of that, it is essential to understand the insecticide resistant profile of Aedes aegypti populations in release area before beginning backcrossing to create a local Wolbachia line. It's a very important thing. Actually, we use the WHO standard protocol, and and mosquitoes were tested for commonly used insecticide classes. In this information, guide to where the source of material for generating Wolbachia mosquito strain. Then we will move on to the what is backcrossing. Sometimes it is not familiar for others. I will explain what is backcrossing. This is the image of the backcrossing. You can see one by line what is the meaning of the backcrossing. I will explain this. Backcrossing involves mating wild-type male mosquitoes with Wolbachia-carrying females that have been reared in the insectary. And then this process produces mosquitoes that carry Wolbachia and have the same genetic background as the local wild-type mosquitoes. Another thing is, after completing this backcrossing process, we need to check Wolbachia mosquito lines checked in terms of quality assurance test before sending to particular country. Then we'll move to the what is outcrossing. Actually, outcrossing, that process conducting after completing the backcrossing. And outcrossing is done to maintain the genetic diversity of the colony and ensure it remains similar to the wild population. This is the meaning of the backcrossing and the outcrossing. Then I will move to that BG traps. What is the earlier I explained what is the BG trap, and BG traps deploy to monitor mosquito across the release site. These are some grids. Grids mean traps need to deployed in a grid, one trap deployed per grid square, and BG traps were placed in households, shops, and public buildings to monitor mosquitoes. People who agreed to have the BG traps installed at their premises, we can place this BG trap in their premises, and during the project period, compensation was paid for the electricity of the household owners. And this then make a BG trap monitoring network. Then after that, BG traps were serviced once a week and collected samples were identified by the laboratory team. And this is the BG trap plan during a pre-intervention period and post-intervention period in this project. And BG traps were deployed in January 2020, and traps were monitored weekly basis for baseline monitoring. Then mosquito samples are preserved for biobanking, and there were 3 release periods were conducted due to the COVID situation in the country. In February to March 2020, then it stopped, then July to October 2020, then again stopped, then February to April 2021, it has completed now. And each and every releasing period, BG traps were serviced weekly basis, and samples were used for diagnosis and the biobanking. The post-monitoring period, we will move post-monitoring period from December 2021 to June 2026. It is planned to deploy that every 6 months and collect mosquito sample for biobanking and diagnostic. This is the overview of the BG traps monitoring. Then we will move to the egg capsules. Egg capsules preparation. Before moving to the egg capsule preparation, there are 2 types of Wolbachia-infected mosquitoes release strategies. This is the adult mosquito releases and egg capsule release. For the adult mosquito releasing, we need actually that mass rearing facility for product the mass number of adult mosquitoes. For the egg capsule preparation, we need a less space, and it's an economical method. Due to unavailability of some mass rearing facilities, it was planned to implement the egg capsule strategy in Sri Lanka. Then we'll see how it implemented in Sri Lanka. The Sri Lanka Wolbachia digital line was established at the Monash University, and they were product mass egg production there. Then these Wolbachia-infected egg batches imported to Sri Lanka during the releasing period, and same time after export to the here, after import to here, then the hatching rate tests are conducted in both parties, and they see the hatchability the hatchability is okay, fine for these egg batches. Then after that, if it is fine, then make the egg capsules. That egg capsule preparation process was conducted in the project laboratory, and this Wolbachia-infected Aedes aegypti eggs mixed with some necessary larval foods and make egg capsules, and around 300 eggs were included in the one capsule. Now we have some idea how to prepare egg capsule. Then we'll move to that preparation for this is the egg capsule releasing container. Egg capsule, before releasing the egg capsule, there's a planning period, actually field release preparation, and we need to identify some households in a particular grid. It also have some grid plan. This is the grid plan for the D1 and Norhayati. D1 area, D1 MH area, grid size is 50 square meter. For the Norhayati MH area, it was 75 square meter. And we need to identify households in the particular grid for keep mosquito release containers. And we need to enter this information into the data management system and maintain that. After that, we have to and we need to train the this team. Because of that temporary basis staff we recruited for this purpose. So we need to train them how to set up that mosquito release containers in the field and how to dispose it in this way, and quality assurance of the monitoring, data management system. This is the things. Now planning phase is completed, and now we move to the field activities. This earlier also I showed this. This is our field release area. now that MRC, that mosquito releasing containers were hang identified households and public places as well. In the with the COVID situation, sometimes we had to move some residential places to the public places due to restrictions of the COVID. And then at the field, we are doing some quality assurance monitoring things for this release in this release activity period. In the visually also we did at the field, see the release box availability, and in the laboratory counting the cephalothorax of the mosquitoes and for selected release boxes. And deployment repeated every week until Wolbachia levels self-sustaining. The percentage was that WML reaches to 50%. Then we'll see Wolbachia frequency in the releasing period. This figure show CMC D1 area in 2 release period Wolbachia establishment. It is in end of the April, it between 30 to 40%. But the thing is, the release happened after the last diagnostic, but that problem is that monitoring had to stop due to the loss area Wolbachia establishment. It was between 50 to 60%. It also happened that same situation that after the last diagnostic release has happened. Then we'll see monitoring the Wolbachia establishment. Actually, during the release period, that this involves trapping mosquitoes in the release area, identify them mosquitoes in traps, identify them then to the species level, then transfer mosquitoes samples to diagnostic laboratory for lamp screening. This figure show that lamp screening image, and that other samples we are sending to the Monash University for the qPCR method identification, and then estimate the Wolbachia frequency in the mosquito population. That earlier graph plot according to this data. Then we'll see that post monitoring activities, and it is mentioned that repeat every 6 months from December 2021 to June 2026 by placing BG traps and OV traps both, and identify mosquitoes up to species level. Then sample has to sent to the Monash University laboratory for the qPCR method. This is all for the Wolbachia project. Then I would like to explain some another observational research conducting in this area. Another postgraduate research is being carried out to study the prevalence of dengue virus in Aedes mosquitoes in this release area. And its objectives of this project is to assess the prevalence of dengue virus Aedes aegypti in during and post-intervention period of the Wolbachia releasing. And these are the collaborating institute of this study: Institute of Biochemistry, Molecular Biology and Biotechnology of the University of Colombo, Epidemiology Unit and the National Dengue Control Unit of the Ministry of Health. And this is the funding, National Research Council is the funding agency for this project. This is actually observational independent research. And in my acknowledgement, I would like to acknowledge one of my postgraduate supervisor, Dr. Hadinegoro Sera, and for his encouragement support for this event, and Director Dengue Control Unit, Dr. Siddharth Samarveera and Dr. Nimalka Panilahetti, and NDCU staff and local WMP team, and Dr. Jackie and WMP project team. They shared a lot of information with me to success this presentation. And IBMB postgraduate research supervisors and NRC grant, and ADVA team to ADVA team also I would like to thank. Thank you.
Thank you, Ms. Sakunthala, for your comprehensive presentation. The discussion will be held after 3 speakers finish the presentation. I think I deliver to Prof. Zul for the moderator for the second speaker, please.
Thank you. Thank you, Sri. Thank you, Dr. Sakunthala. It's my pleasure to introduce the second speaker for today, Dr. Norhayati Mokhtar. She is the public health specialist and senior principal assistant director in charge of dengue in the vector-borne disease sector. And she graduated from the University Sumatera Utara, Indonesia in 2002 and obtained her master's in public health as well as her doctorate in public health in 2013 and 2017, and has been working in various fields in public health, especially in health clinics in the districts. And currently she is in the dengue unit of the vector-borne disease sector, Disease Control Division of the Ministry of Health in Malaysia. So over to you, Dr. Norhayati, to present the Malaysian perspective of this issue.
Thank you, Yang Berbahagia, Prof. So I will start sharing my slides. Assalamualaikum and a very good afternoon, everyone. Right. So thank you, Prof, for the kind introduction, and I would also like to thank ADVA for inviting Ministry of Health Malaysia in sharing our experience using Wolbachia mosquito in our national dengue prevention and control program. And I think without any delay, I will share my slides now. So this is the outline of my presentation. So as an introduction, I will touch a little bit on current dengue situation in Malaysia, and followed by a chronology of Wolbachia mosquito operationalization. And I will also like to touch on what the operationalization is all about. And we will also look at the endpoints monitoring, right? And then the operational challenges that we are facing while running this program. And lastly is the summary. So from January until 12th of September, we have a total of 18,613 cases reported. And compared to the same period of last year, there were 72,952 cases reported, which brings to reduction for this year by 74.5%, or reduced by almost 54 over 1,000 cases. And similarly for dengue death, until now we have 10 deaths reported. And compared to last year, which is during the same period, there were 118 death reported, and this brings to reduction by almost 92%, or reduced by 108 deaths. And as for the case fatality rate for this year until today is 0.05, as compared to last year where the case fatality rate was 0.16%. So this is the weekly dengue trend in Malaysia, where we can see the red line is represented, the red line represents the weekly dengue trend for this year, for the year of 2021. The blue line represents the weekly dengue trend for the year of 2020, and the green line is the weekly dengue cases for 5 years median, which is from 2016 until 2020. And we can clearly see from this graph that the dengue endemic trend in Malaysia is always characterized by two peaks, which is the major transmission that occur from June until September, and the second transmission, or the second peak, usually starts from September until March. And when we look at the line, the red line graph, which is the weekly dengue cases for this year, for the year of 2021, the similar trend usually actually exists, although we can hardly see them, right? So this is the traditional dengue endemic trend in Malaysia. Okay, next please. And this is the slides that shows the number of dengue cases and death from the year of 2000 until 2021. So what I wanted to highlight here is the dengue incidence in 2019, which is the highest ever been reported for the past 20 years. So this is one of the main reasons why Ministry of Health decided to embark on the Wolbachia mosquito operationalization. Right, next. And this is a brief chronology on how our journey with Wolbachia mosquito began. So it starts from the field trial phase by IMR, where it starts with the planning to release Wolbachia mosquito in 2016. And following that, they have launched a Wolbachia lab, right? And they start releasing the Wolbachia mosquito in 2017 until 2019. And for the operational phase, it starts when we decided on the formation of National Wolbachia Technical Committee after the high sky incidence of dengue in 2019. And then the surge of dengue in 2019 also caught the attention of our leaders in the government. And following that, a national special dengue task force meeting was held. This was chaired by our Deputy Prime Minister at that time, right? And following that, we have also conducted expert consultation workshop where we have consulted experts from the Wolbachia field. And following that, also we have conducted a community engagement at the selected localities, and it starts with the kick-off phase in July 2019. And our aim is to accomplish 30 localities, by the year of 2022, right? Next slide. Right. So this is just to share one of the article that was published in 2019, about the successful establishment of Wolbachia in the community. This is in Malaysia. And next slide, please. And basically the result shows that the reduction in dengue incidence, there are reductions in dengue incidence in all of the intervention sites. So this was conducted by the IMR, where the reduction ranging from 44% until 77%. So these are the trial phase done or conducted by the IMR, and I would like to acknowledge IMR for these slides. Next slide, please. Right. And there's another journal here that shows that after the termination of release or the completion of release after 2 years, meaning that there's no more release, free release, all right, the Wolbachia frequency still persisted at a very high frequency, and also that it shows a significantly reduced dengue incidence at the release locality, right? The next slide. Okay, and this is a slide that illustrates the two Wolbachia-based strategies, right? And which is the replacement strategy and suppression strategy. And for Malaysia, we use the replacement strategy, where in replacement strategy, the Wolbachia mosquito release is both the female and the male. And over time, the Wolbachia mosquito will introgresses into the local Aedes aegypti population, resulting in all of the mosquito population will become a Wolbachia mosquito. And on the other hand, the suppression method, only the male Wolbachia mosquito will be released, and mating of the male Wolbachia mosquito with the female will result in a non-viable embryo, meaning that the eggs will not hatch, and this will eventually suppress the mosquito population at the release site. Okay, next slide, please. And one of the important aspect in Wolbachia operationalization, is the locality selection, where there are a few criteria that need to be fulfilled. For example, the selected criteria must be of high burden dengue cases, right? We also look at the type of premises, where the preferred premise is the high-rise building or flats, all right? And we also have to look at the natural boundaries, for example, rivers. Were there any rivers or highways or park or open space? Okay, the reason being is that we want to minimize the immigration of the wild mosquito from the surrounding area to our release site, right? And we also must make sure that there's no adjacent factory or no factory nearby. And we also have to look at the coverage area, number of households, and most importantly is the good public cooperation and support. And all of these criteria will be scored, and the most appropriate will be selected as the release site. Next, please. And this is the example on how we select the locality. And as you can see, these are the criteria. The total dengue cases, incidence rate, the coverage area, the boundary, right? And one of the important things that we have to also consider is the buffer zone, which is the area of 200 meters from the outer boundary of Wolbachia mosquito release locality. Because there could be some spillover effect, or this is a positive effect that the Wolbachia mosquito will also spread to the nearby locality or to the buffer zone, because as we know that the flight range of Aedes mosquito is 200 meters, right? Okay, next slide, please. Okay, now for the operationalization for dengue control. So these are the phases that we have now. We have phase 1, phase 2, and phase 3. Where phase 1 was started in July 2019. So there are 11 localities, right, in Klang Valley, and the phase 2 started at the end of 2019. Where there were additional another 8 localities and additional state, which is Pulau Pinang. And in phase 3, until now, we have 3 localities, and the remaining 8 localities, okay, we plan to release by next year. So until now, we have overall 22 localities, and all of these sites are recalcitrant dengue hotspots, and most of them, I would say, are of high-rise building structure. And in terms of the strain of the Wolbachia strain that we use in Malaysia, it is the Wolbachia albopictus B, which is a strain from Aedes albopictus. And in terms of colony production, the sole producer is now from the IMR, but the operating budgets, for example, for the additional staff, for us to hire additional staff, for equipments, for insectariums, under the Ministry of Health, where we distributed the budget to the district health office and state health offices. And this operation involves multidisciplinary team, right? So it involves epidemiologists, entomologists, the health inspectors, health education officers, as well as the local municipal. And for the prevention and control activities at Wolbachia mosquito release site, a big no is that there will be no fogging done in those areas, right, as it would kill our Wolbachia mosquito. And as for dengue enforcement, it goes on as usual. Right, I would like to share a little bit on the activities that we do before and during the release. So basically 4 days before the release, there will be mass fogging, mass cleaning up, and mass larviciding. This is to ensure that there will be no breeding containers other than our release container. Okay, so then after 4 days, there will be a release of eggs or adults or combination, where the release of eggs will take every 2 weeks, meaning that every 2 weeks we will put the release container containing the eggs of Wolbachia mosquito. And then, but if we conduct release of adult, it will be every week, right? Then after 2 months of the 8 weeks, we'll put the OV track monitoring for the monitoring of the frequency. And if it's managed to get more than 80% for 2 consecutive monitoring, then we will stop the release. So this is the 2 important indicators that we monitor. First, this is the epidemiological endpoints, which is the weekly confirmed dengue cases reported from that area. And the second indicator is the entomological endpoints, which is the Wolbachia frequency in the environment. So this is the prelim findings of our epidemiological and entomological endpoints. So for the epidemiological endpoints, so these are the 17th locality that we have released the Wolbachia for 2 years, that has completed for almost 2 years. So we have 17 localities, and out of these 17, I would say almost all of these localities shows reduction in number of dengue cases reported, right? Except for two, which is W04. Next slide, next please, which is W04, right? Where the dengue case reported in that area 6 months prior to release there were 4 cases, but after 1 year, which is at the 18th month until from the 13th month until the 18th month, there was 7 cases. And another locality is the W17 or Manggis. This is located in Pulau Pinang, where 6 months pre-release, there were no cases reported. And after 1 year, there were also no cases reported. But basically, yeah, all of the localities shows reduction. And when we total up all of these localities in terms of the dengue case reduction, so the reduction is 94%. So this is in the graphical form. So the red bar is the number of cases of all of the localities 6 months prior to release. And after 1 year, which is from the 13th month until 18th month, okay, there were only 47 cases being reported, which represented by the green bar. Okay, so this is for the endpoint 2, which is the Wolbachia frequency. So from our analysis of the 17th locality, for us to get a stable Wolbachia frequency, so these are the points that we concluded. First is that the median number of patches needed for the Wolbachia mosquito releases, yeah, to achieve the 2 consecutive months was 14 batches. All right, that is number 1. Number 2 is that the number of weeks needed for the Wolbachia to sustain in the environment at the frequency of 80% was 8 months or 34 weeks, and the median number of booster releases that need to achieve back, okay, to get back to 80% or more than 60% was 8 batches. Okay, so in general, or in summary, okay, after 14 batches of release, we expect the Wolbachia frequency will be stable in the environment, and then there will be 8 months free release. But after 8 months, we need another booster to make it or to make it maintain in the environment, to make sure that the frequency maintained in the environment at the frequency of more than 60%. Right, next slide, please. All right, I would like to also share a few localities. Okay, next slide, please. Right. So the first one is W01 Kelana. This is located in Petaling Jaya, right? Next slide. I'm sorry for these quite busy slides. Okay, but what I wanted to point out here is that first, maybe we can look at the dengue trend, okay, from the year of 2018. Okay, we look at the dengue trend. So firstly, there were 2 graphs here. So the upper graph is the epidemiological monitoring, okay, where we monitor the epidemiological outcome, right? And the lower graph is the entomological monitoring, where we monitor the frequency, the Wolbachia frequency. So, and we get back to the epidemiological graph, yeah. So what we monitor is, first is the Wolbachia, the dengue cases. And as we can see here, the trend shows a reducing trend, yeah, from 2018 until 2021. And in fact, there were no cases reported in 2021. And another indicator that we should look at is the Wolbachia frequency, which depicted by the this diamond, okay, diamond shape. The moving average diamond shape is the Wolbachia frequency, right? And as we can see, once the Wolbachia frequency becomes stable, yeah, in the environment, the dengue cases keep on reducing until there's no cases in 2021, right? And for the entomological monitoring, so similarly, we are looking at the Wolbachia frequency, but there's another thing that we also look into is the proportion of index of Albopictus and Aegypti, where we expect that the Aegypti index will be much higher than the Albopictus index. And when, for example, in EPID week of 2021, we can see that the bar graph, the bar of the green bar shows much higher than the red bar, yeah, at this EPID 2021, EPID week of 21. This may be a signal that there's an invasion of Albopictus from the surrounding to our release site, and therefore we need to troubleshoot, yeah, in terms of cleaning up, do some search and destroy activities in the area, right? So next slide. Next. So this is the summary of cases, right? So there's no case in 2021 here in WO1 Kelana. So another locality, WO7, this is also located in Petaling Jaya, which is a high burden area, for dengue. So similarly, for the upper graph, is the epidemiological monitoring, and I think we can clearly see here, once the Wolbachia frequency start to pick up and become stable in the environment, okay, the number of dengue cases reduce, And for everybody's information, in 2021, we only have one dengue case reported, right, until now. Okay. All right, next. Right, okay. And this is the last examples of the locality, okay. So WO9, Penara. Okay, next slide, please. All right, similarly, okay, we can see the similar trend. Once the Wolbachia frequency picked up, okay, and become stable, the cases, okay, starts to reduce, and in 2021 we have 5 cases reported until now, right? So this is a few pictures here on how we conduct the community engagement, before the release of Wolbachia mosquito. This is in Petaling district, okay, and these are the preparation done at the locality, at the locality itself, before the release of Wolbachia egg, Wolbachia mosquito, which is during the egg stage, right, where we put we will put the eggs in these containers, put some water and the food for larva, right, and then we distribute them, and these are the sites where we put, for example, at the box here, at the post box, in the apartments, right. Next slide. This is during when during the MCO, where we change here, we modify a little bit on the release, where from egg release we modify to adult release in order to limit our healthcare staff contact with the public. So we changed to adult release at this time, and this is a few pictures on how the adult release was done, right. We put the mosquito in the cup, cover it with tags, and release it at every floor, right. And this is a few challenges that we face, as I mentioned before, that not all hotspots are suitable for Wolbachia release. They need to fulfill a few requirements. For example, the type of dwelling, where the preferred type of dwelling is the high-rise building, right? And we also got to have a clear natural boundaries, in order to prevent or minimize immigration of Albopictus or wild Aegypti into our release site. And we also have to bear in mind that the Wolbachia strain, they have no efficacy on Albopictus, and therefore the dengue outbreak could still occur. And in view of that, search and destroy activities must always be empowered to the public. But a big no, as I mentioned before, that no fogging should be done. And we also have to remember that there will be a possibility of invasion of wild Aedes aegypti and Albopictus, and therefore we must always keep the environment clean. And then, as I mentioned before, regarding the buffer zone, So the buffer zone need also to be treated similarly, yeah, as the Wolbachia release site. And particularly during this COVID-19 pandemic, there are a few competing priorities lah. Yeah, for example, in terms of financial support and collaboration from stakeholders. Yeah, for example, during this COVID-19 pandemic, there will be mobilization of our vector staff for COVID operation, for example, right? And there will also be some suboptimal coverage of Wolbachia mosquito release. For example, when the area is under the full lockdown implementation, so we couldn't do the release. Yeah, and finally, yeah, the success of this project really depends on the community acceptance, collaborations, and support, and therefore we always have to make sure, yeah, that the community really engage in our Wolbachia activities. Okay, I think this is just a recap. Yeah, so what we have observed is that our Wolbachia mosquito operationalization appears to be promising, where almost 90% dengue case reduction, yeah, seen in 15 out of 17 localities. And the reduction was ranging from 67 until 100% after 1 year of implementation. And in fact, 7 out of 17 localities did not report any case after 1 year of Wolbachia release. And 94% of the localities, which is 16 out of 17 localities, managed to reach the Wolbachia frequency more than 80% for the 2 consecutive months, and the release has been stopped. However, it gradually dropped, yeah, and hence we release the booster release, right? And finally, I think Malaysia, okay, we were committed to expand this Wolbachia mosquito operationalization to other localities with high dengue burden. I think that's all from me. I really apologize for the difficulties during my presentation. And then, yeah, that's all. Thank you.
Thank you, Dr. Norhayati. No problem with the technical, always an issue. Prof. Sri, would you like to introduce the next speaker?
Yes, thank you, Azul. Now, for the last speaker will be Dr. Claudia Surjadjaja. She is a regional director, Asia of the World Mosquito Program. She is a public health professional with expertise in organization leadership, health program management, supporting organization and policymaker to develop public health policy and implementation strategy, as well as building human capacity. With more than 20 years practical experience across from the 30 countries, Claudia is passionate about global health and the design, management, and evaluation of the infectious disease and health system strengthening program. And she has been engaged in a high-level consultative and advisory roles with a global organization. And she transitioned from clinical practitioners to public health, where her passion lies. Her qualification include Master of Public Health in Health Service Management from the Gadjah Mada University, Master of Science in Medical Ethics from Imperial College London, and Doctor of Public Health in Epidemiology and Public Health, Population Health. Now, Dr. Claudia brings a diverse range of skill and expertise to her current role as a regional director, ASEAN World Program, Mosquito Program. The topic will be a mosquito story from Indonesia to the world. Please, Dr. Claudia, the time is yours.
Thanks, Professor Sri, as the last speaker. Actually, this is already question and answer session, so I have 1 minute to present. No. I will try to present as fast as Wolbachia win over dengue virus. Next, please. So we started, the World Mosquito Program started with eliminate dengue. Actually, it was research of our program director, Professor Scott O'Neill. As we know, the Wolbachia bacteria already found in 1920s, and a lot of studies, only until recently we saw the effectiveness. So World Mosquito Program is a not-for-profit initiative that protecting communities around the world from Aedes aegypti. I will not present about the technical anymore because our two colleagues from Sri Lanka and Malaysia already talking about that from entomological point of view and the method itself. So I would just like to present the possibility of role of Wolbachia program in vector control, knowing that the current vector control strategy is not optimal. So we have been pioneered this and then few than 10 years. Now we expanded from Australia and working in 11 countries. Please click the link if you want to know more about our story. Next, please. So Wolbachia innovation, what WMP is naturally occurring bacteria. It's safe for humans, animals, and the environment. We did some risk assessment at the beginning to see the impact on human safety, animal safety, and environment. It can reduce abilities of mosquitoes to transmit diseases. This is dengue, Zika, chikungunya, and yellow fever. And it is sustainable. So the method does not need to be reapplied year after year. And because of this, it's cost effective. Next, please. So these are WMP projects. At the moment, we're working in 3 regions. Soon will be 4 for Africa. So we have 3 hubs. It's Asia hubs in Vietnam, where I'm based, and then the Americas hub, and also Oceania hub based in Monash University. Next, please. So we started in Australia, that's down under in northern Queensland, in a small town called Townsville, and it started in 2011. That's the first release conducted. And after 10 years, we recently just celebrating the 10 years release. There is no dengue cases anymore in there. So, and then from Australia, it's soon, we started in 2014 with Indonesia and Vietnam. And there's a small place in Vietnam in Nha Trang, and like tiny island of TNI. I will explain about it later. And then after this, 2015, we expanded to Brazil and Colombia, then followed by the 2018 in the Western Pacific, in Fiji, Vanuatu, and Kiribati. Then we started in Sri Lanka, which our colleague already presented the project, and New Caledonia. The last one is Mexico. Next, please. So this is the project site implementation. We can see the timeline from 2011 until this day, and the population and area of coverage from each of the sites. Next, please. This is the reduction in North Queensland and Australia. So we saw 96% of reduction on the dengue case notified. Next. And the one is in Rio de Janeiro and Niterói in Brazil. We can see the dengue reduction in cases by 73%. And chikungunya, next please. And in chikungunya, 74% of reduction in notified cases. Next, please. There is a quasi-experimental study in Yogyakarta in 2016-2017. We collaborate with Universitas Gadjah Mada, supported by KIDS, and then supported by Yayasan Tahia as well. From this quasi-experimental study, we saw a 76% reduction in dengue incidence. Next, please. So within 11 years, or less than 10 years, we now work in 11 countries and we cover over 7.7 million people reach. So to reduce dengue, and you can click it later, see the time post release in each project site. Next, please. As we know, WHO has a hierarchical for factor control efficacy trials with level 1, the randomized control trial, as the gold standard. Next. So we did that, level 2 in Indonesia, Vietnam, and Brazil. We also did level 3 at the early beginning in Northern Australia. So what next? Of course, we want to do the level 1 or randomized control trial, which we did finally in Yogyakarta and saw the results. Next, please. Next, please. Next, please. So the dengue burden in Indonesia, as we can see, we have a lot of dengue cases and it's repeated annually. This is the data of the incidence rate for 9 years, and also by population and by province, per 100,000 population by provinces. Next, please. And this is the chikungunya burden. Next, please. So WMP Indonesia, after the quasi-experimental, we did the RCT for 3 years. And then we can see the timeline here. The project started in 2011. And then again in 2016 with the RCT. And then the most important part of this project is the community engagement. Without the community engagement and acceptance, we will not be successful. So this is a release phase. And the RCT just completed in June 2020. The results were announced in August 2020 last year. And then currently we are doing the citywide expansion in the control area of Yogyakarta, just finished. And now we're doing in Sleman and Bantul. It shows 77% reduction in dengue incidence and also 86% efficacy against hospitalized dengue. The results have been published in New England Journal of Medicine in 2021. It's a month ago. Very recent. Next, please. And we got approval as well from the FICAC WHO, which this is a summary of the 13th meeting of the FICAC meeting at 8th of March when they put it in the evidence of the Wolbachia method. So and the next, currently we are also applying for the recommendation based on this FICAC approval. Next, please. Next. So what's next after the RCT? What is our strategy for Indonesia? So Indonesia actually just released their first national dengue control strategy. And this is just like maybe like end of August or early September, and it has 6 strategies, and Wolbachia is stated in strategy number 6 under the innovation along with the vaccine. So we are in the discussion with Ministry of Health on how to do the roadmap on this. Why Indonesia? Next, please. This is an epidemiology modeling that we believe that we can cover 7 million daily cases, and this will save us of US 1 billion every year with the current dengue burden in Indonesia. Next, please. So Wolbachia is suitable with the climate of Indonesia. Indonesia climate, as we know, is tropical climate, humid, not so fluctuated in the weather. It's almost stable, and then enough of rain as well. Next, please. And Okay, so we have like several priorities in a priority area, priority provinces, and this is our project timeline in Indonesia. And at the end, we want to cover about 7 million dengue cases, or avert 7 million dengue cases, and also avert 1 million of number of hospital days. Next. As we need a lot of eggs, we also plan to have the mosquito mass production facility. And our colleague from Malaysia already explained as well, and Sri Lanka, about the egg capsules. So we want to produce more egg capsules with this mass production facility. Next, please. MRC. As we can see already in the presentation, there are many MRCs we're trying. There is bucket we use in Yogyakarta. There is a noodle box. So we try to try which MRC is more effective, and especially when the community engagement now is more priority because of the COVID restriction situation. So next, please. So this is a deployment model. We can deploy it direct to the household. We can hang it in public area or put it there, or the community can come to places, to gathering places, and collect that. We're going to try again like contactless delivery in Bantul. So next year. Next, please. And Bali. Why Bali? Everyone know about Bali, and this is the whole island. And Bali got hit with COVID situation and tourism decline, economic decline. So this is not only about public health, but this is about the whole regaining Bali or resuming. So we plan to actually dengue-proof Bali. Next, please. So our deployment in Bali, we will concentrate in 3 urban areas. Concentrated in the south, it's Denpasar, Badung, and Gianyar. And then again, these target populations have been identified to dengue-proof Bali. So a total population of 3 million Balinese can be protected with our phases of deployment plan. We have 6 phases to cover the whole Bali. Next, please. In Vietnam, what's going on in Vietnam? So dengue is endemic throughout the southern region and central coast. And we did our first release in central Vietnam, which I pointed before, in a tiny island, it's Tri Nguyen Island, near Nha Trang City in Can Hoa province. And then now we also did our first release in Vinh Long. This is still in central Vietnam. So please click the link if you want to know more about our results in Nha Trang. So currently, we're scheduled to release for 2 sites, 2 places nearby Ho Chi Minh City. So in southern Vietnam, so this is My Tho and in Tiên Gang province, and the other one is Tô Yau Mot in Binh Duong province. We're scheduled to release in February next year. And we already collaborated with NIHE and Pasteur Institute to have our rearing in Ho Chi Minh City. Next, please. As we can see, in Nha Trang previously, we also found significant reduction in dengue incidence, which is 86%. Next, please. In Sri Lanka, I will not talk a lot about Sri Lanka because our colleague already said that. So we started in Sri Lanka a partnership with the Ministry of Health in July 2017. And then we just finished our phase 1 Colombo. And then next year, we will do wider Colombo release, still in collaboration with the MDCU, Ministry of Health of Sri Lanka. Next, please. So to summarize the Asia plan in Indonesia, we want to target Bali that can protect 3 million people, as well as a national rollout in Indonesia that can protect 17 million of Indonesians. That means averted 7 million dengue cases. We are still in discussion with the Ministry of Health on this. And then Sri Lanka, we can click this. Wider Colombo release will be in 2022. And we can see the global progress in Sri Lanka by clicking that. And again, in Vietnam, we will do the release in February 2022, another link. And in Laos PDR, we've just finished our entomological study in 2020. And now we're going to have a release, the first time release in Laos, with collaborating with Ministry of Health in Vientiane in 2022. Next, please. So in summary, we work with government and community partners. And again, without the community engagement and community acceptance, this will not be successful. Usually, we spend 1 year for preparation to engage the community. And again, the Wolbachia method is not an emergency measure, but this is a long-term self-sustaining solution that can reducing mosquito-borne disease. It is compatible with other methods such as our current vector controls and also vaccines. So our Wolbachia method can be transitioned for our virus control to sustainable care. Thank you. Over to you, Prof.
Yeah, thank you, Dr. Claudia. There are a lot of questions now. I think we come to the question and answer. I think Prof. Sri, you have to help me out here. We'll handle some of the questions first with the ones that are directed at. There are quite a number of questions for Dr. Norhayati. I think you all can read the questions here, but let's handle some of the questions for Dr. Claudia first. One of the questions is the one that state how the WMP chooses the countries that it decides to work with. How does WMP select the countries that they partner with for their project?
Thank you, Prof. Zulkifli. We usually collaborate with Ministry of Health. So without the government buy-in, it would be difficult for us to operate. So usually we start collaborating with either a research institute or government entity like Institute Pasteur or university, and also with Ministry of Health like in Sri Lanka. But first of all, we need the buy-in. One from the government, and second, of course, from the community itself.
Okay. And then the other one is the decrease. This is a question from Dae-Yun Kim. And he says that I could see the decreased cases with the projects in all the countries, but I wonder how is the vector density with the virus. I think it has been monitored in Sri Lanka using BGS traps. Could you give us an answer to this? I think this is for Sri Lanka.
Yes, that Professor Zulkifli, that mosquito density is monitoring with the BG. Yeah, can you hear me?
Yes, yes.
That BG traps monitoring is done with the mosquito density monitoring, but actually in the releasing period, mosquito density is increasing, but but in after releasing, it little bit decline. We are not getting some information for this one yet, because of now we are in the post monitoring period. This time, due to that lockdown situation, we need to start again in the according to the plan. Post release activities we need to start in December 2021. So still waiting to see the mosquito reduction or increasing.
All right. This is a technical question. I don't know whether any of you could answer this. Can the Wolbachia mosquito initiative be combined with the Oxytec genetically modified mosquito technology to further strengthen our fight against mosquito-borne diseases? I have no idea what the Oxytec technology is. Dr. Claudia, do you know what it is?
Yeah, well, it's Oxytec use different methodology. We use replacement, and then it's also different with the one by the Singapore government. So we use replacement. We release only female mosquitoes, but maybe in the future we can also combine that. So attacking the dengue from all over, because it's our aim is the same. We want to reduce dengue. So whatever the methodology is, we can collaborate.
I think we'll move to Dr. Norhayati because we've texted Dr. Claudia a bit too much already. Dr. Norhayati says here, let me just go up to the top because there was one question on cost.
That's from
Yeah, what has the program cost been so far?
Oh,
And where does the funding come from? And what's the size of the human population being protected? So this is a question to both Dr. Norhayati and Dr. Sakunthala.
maybe I can answer on the costing part. So as for Malaysia, the cost for this Wolbachia operationalization comes from Ministry of Health, where we were given a special budget, to run this operation. And in terms of cost, I think we can divide into capital cost. First is capital cost, or that is for the initiation of the operation, right? And then the second one is the maintenance cost. So I would say that in approximate cost for the initiation of the program, maybe we need about 150,000. 150,000 ringgit. That is in ringgit. That is with exclusion of the cost of the mosquito, right? And then and so that is the capital cost, or the cost to initiate the project for the first locality. For example, we need insectariums, right? And then we need the PCR machines. So all those costs, there are about 150,000. But for the maintenance, meaning that if you want to add another localities in that existing locality, maybe the maintenance cost is about 105,000. So that is just approximate or crude figure.
Okay. So that 150,000 would be about divided by 4. Would be about what? I don't know. Francis, can you calculate that for us?
Maybe about 40,000
US dollars.
40,000.
Yeah, about 40,000 US dollars. Dr. Sakunthala, do you have anything to add to that?
Yeah, that population cover
Yes.
for the releasing area around 220,000 population. Actually, that funding agency for throughout the whole project, WMP program. So still not we take that Ministry of Health funds, and from the WMP funds we run this pilot implementation project.
So you're saying 220,000 population, right? Okay. All right. And then how long is the program from training to full implementation?
Maybe I can answer. As for Malaysia, I think from training until the full implementation, it takes about 1 year. So for example, we planned initiation or formation of the committee starts in February 2019. Actually, it takes less than 1 year, and we implement in July 2019. For the operation. It takes about 6 months.
Is that the same with Sri Lanka?
Yeah, that initial, actually that whole period, there's a training sessions. Because of that, for the implementation process in initial phase, how to do the ovitrapping and these things, then we are having a training. And then after that, we are coming to that VG trap monitoring and other things. Then that project teams conducted the training. Likewise, I think that whole the implementation that project period, we are having some training session from them.
In this, Prof. Sri, do you want to, have you got any questions you want to read
Yeah.
out?
We still have a question left here for Dr. Sakunthala, Ms. Sakunthala. How do you explain the dengue trend so low in 2021 versus
That's Malaysia. That's
past
Norhayati.
5 years? Oh, that is Malaysia? Oh,
Yeah,
sorry. Yes,
Because-
please, Dr. Norhayati, maybe can you answer about these questions?
Yeah, that is a difficult question indeed. But there are a few assumptions on this, okay, because we have yet to conclude what is the real contributed factor or attributed factor that caused the reduction in such a great reduction in dengue cases for this year and last year as well. But there are a few assumptions. First is that during the MCO, right? During the implementation of MCO in our country, during the first 1 month, we can see a very huge reduction in dengue cases, where the incidence dropped until almost 30%. And for the observation, we may say that because of people are staying at home, yeah, and there were fewer host and vector contact, yeah, less people are being bitten by a mosquito, and that is why one of the incidents why the cases dropped. Second is the alteration of the environment, where when people stays at home, they don't go outside, they don't dump rubbish, so there were less breeding containers outside, and that may contributed to the fewer dengue cases. And also because of the movement restriction order, right, where we couldn't go to any state, we couldn't go to any other places or any other states, right? So there are limited movement. So the asymptomatic dengue patients, yeah, are restricted, or they couldn't go to the native population and spread dengue there. So yeah, that is more or less of the assumptions on why we have so our dengue cases reduced greatly for this year.
Is there possibility that the surveillance for the dengue is disturbed by the surveillance of COVID?
I would say no, Prof. I would say no. I think they are reporting as usual. Okay, we are capturing the number as usual. But maybe due to the COVID, there might be some possibility that people might be afraid to seek treatment, right?
Yeah.
And because dengue is a self-limited disease, so they just get resolved by themselves. That is also one of the possibility. But we in Malaysia, we are in the midst of preparing or initiating a study to see what is the attributed factor on this scenario.
Okay.
Yeah, that's all for me.
Maybe I want to ask one more question from me. Does the government of Malaysia already accepted this program and will apply to all over the Malaysia? Do you have any plan for the year?
Thank you, Prof. Yeah, as I've mentioned before, our government really support this program, and it has been formalized. Yeah, during when they announced in 2019 by our Deputy Prime Minister at that time. So we are going to formalize this program, and we are going to expand the localities. Yeah.
Okay.
Thank you.
Yes.
A quick answer to Dr. Dayun Kim. He's asking about Malaysian ringgit and US dollars. 150,000 is actually 40,000 US dollars. Yeah.
Yeah.
Okay. Dr. Claudia, how you handle the Wolbachia operation since most of the areas are restricted to movement due to COVID-19, and so how do you actually go about your work when there's restriction of movement of people and research team?
Yeah, I think there are two questions similar. It's about the limitation, mobile restriction during COVID. We did some pause in Indonesia and also in Sri Lanka several times on the early COVID. But again, we have to be adaptive. So adapt and then overcome. So in Indonesia, after Yogyakarta and Sleman, we also collaborate with community gatherers. These gatherers actually live in the village. So they actually reside there. So sometimes the domestic or village, internal village, they can still move around. So this is part of the solution. And then we try to reduce staff release and using the community gatherer in the village. Another one in South Vietnam, when we are still in the states of community acceptance and community engagement, because of the situation, we can no longer to be in the place and then do the face-to-face as usual. So we try to adapt again with the offline using all social media. So this is a new innovation as well. We have to. And then another one, as I mentioned, because of COVID, we also try to do some research about contactless delivery. So this will be done again in Bantul. So again, COVID changed everything, but for us to be more creative, so adapt, improvise, and overcome.
Thank you. Question here on the specifics. In the study site for the trap deployment, why did they use grid 333 meters by 333 meters? Is there any standard for this? 333. I think it was Dr. Sakunthala mentioned this.
Only that this is planning.
You have to speak nearer the microphone, please, Dr. Sakunthala. We can't hear you.
Yeah. Sorry. Yeah, that actually these grid sizes determined from that WMP team, considering the population density and that area of the selected sites. Considering these informations, they selected this kind of grid sizes.
Dr. Norhayati, a few questions here for you. During this COVID-19 pandemic, is there any possibility that people with mild symptoms of dengue fever refrain from visiting health center? I think you mentioned that already.
Yeah. There is quite a big possibility.
Yeah. Okay. The other one is presenting the change in dengue cases pre and post release in the form of case proportion over the total number of cases in the region or district or area. Example, in the form of dengue case ratio, be a more accurate picture of the positive effect of the program. This is because dengue incidence in an area changes with time. What if it so happens? So you got that question?
Maybe what I would say that as we know that dengue is notorious of being seasonal and cyclical, to really point out that certain factors contributed solely on the incidence of reduction in incidence of dengue is quite difficult because dengue is multifactorial. There were interplays of multifactorials. I think we need to have a thorough investigation, thorough research on this.
So you need a longer monitoring time then. See whether it's really effective, right? Yeah, yes, Sri?
Yes, there's still two questions for Dr. Claudia. The first one is, how does WMP select the countries that they partnered with their project? And the other one is, do you know about the Thailand situation for dengue due to Wolbachia program?
She answered the first question already. The second question.
Already?
The second question.
Okay, the second question, please, for the Thailand information.
We all want to know about the Thailand.
That's fine. Because like first requirement when we want to work in a country.
I think so.
whether the country has dengue cases or not. That's number one. We will not work in Russia, for example, because there are not many dengue cases there. So that's pre-requirement. And then, of course, we have to see also the weather. And again, the climate is important. As Dr. Noor also mentioned, the rainfall, the season, the temperature, it's all important as a selection criteria or prerequisite for us to work. Thailand has their own program. So I think it's part of the Ministry of Health or Research Institute in Thailand.
Okay.
Dr. Nahati, there are a few more questions here. What's the size of the population, the 30 localities, and what are the indicators of public support to the program?
Thank you, Prof. So as of now, we have 22 localities actually, and we aim to have 30 localities by next year, right? So for the 22 localities, this is because I do not have the number in my hand now. There were approximately 250,000, same as in Sri Lanka. Yeah, the coverage of the population for all those 22 localities. That is approximation figure. And then what's the next question, Prof?
The next question is what are the indicators of public support to the program?
Because we are running this operationalization as an operation, so actually we did not measure, or we did not take the public support as one of the indicators. But yes, it is not easy though to get public support, but we are trying our best to have support, yeah, and participation from the public. But from the field trial phase, the support and the backup from the public was good because we have a very good community engagement. Okay, it is almost every week that the IMAR staff, the IMAR team, they went down to the communities. They meet the local municipals, they even meet the MPs and the head of the JMB, the Joint Management Board, in where the residents reside. So we really have dialogues, we have flyers and all those things. So support was very good from the public. And in fact, I think until now there's no huge objection from the public, and they are happy that cases have reduced at their residence.
We have any studies where they compare areas where Wolbachia infected mosquitoes and non-Wolbachia mosquitoes, whether there's a real drop. I know somebody presented in Jakarta. They compared one area that had Wolbachia and the other area that had no Wolbachia, and there was a significant drop in was that ever done in Malaysia?
The one that you mentioned was done in Jogja with the methodology of RCT, if I'm not mistaken. But in Malaysia, we conducted intervention and control study, so it was not RCT.
Here's a question for everybody, right? This is a broad overall question. What do you think will be the role of Wolbachia program in the bigger picture of dengue control?
Okay, maybe I would like to answer first. So okay, although we are having a great reduction in dengue cases right now, okay, I think we should still embark on Wolbachia as a preventive measures. Yeah, although because we do not know when the dengue will have a spike. Yeah, as it is, as I mentioned before, it is cyclical in nature, cyclical and seasonal, and could be that this time is when the cycle drops, right? But we do not know when it will spike up. So I think it is a good anticipation in implementing Wolbachia, even though the case is still low at the moment. I think that is from me.
I can add to that. So this is also one of the questions whether the methodology can be implemented together with other vector control activities. And the answer is yes, absolutely. So Wolbachia method is just one complementary of the current vector control strategies. In several of our sites, the current vector control strategies or activities are still being conducted. So it's like fogging and cleaning all the puddles. In Indonesia, we have 5M or 5Ms, and it's still ongoing. So this is complementary to that. And also the vaccine will be complementary. Prof, can I answer one question from the Philippines?
Of course, please. You're being invited to the Philippines, though.
Well, actually, we've been in discussion already with the Philippines prior to COVID. We're also in the discussion with Taiwan, Bangladesh, and Pakistan. So COVID may stall us a bit, but I will come back to the Philippines. Salamat po. Thanks.
Yeah, you wanted to answer something from the Philippines? Dr. Claudia, do you want to answer something from the Philippines just now?
I just did.
Okay, all right.
I just did. We're in the discussion already, and it's get paused along with other countries, and we will resume as soon as the country is ready. Thank you.
All right.
Yes, okay, maybe one more, Prof. Zul, one more question. That important one is how the acceptance by the community, this program. Maybe could you answer by the three speakers? Do you have challenges for this? The communication with the community, especially in the site of study? Could you have experience, Ms. Sakunthala?
Actually, that communication and community engagement is the huge part of the Wolbachia project. Actually, that lot of funds are also allocated for this part. If the community is not accept this method, we can't proceed the Wolbachia method. I think that in Sri Lanka also we face some difficulties for the community and community engagement. But however, in our communication team, with the Dr. Nimaka and the team, then they handle these things, and finally that they win this task.
Mm-hmm. But in Malaysia, Dr. Nur?
Yeah, as I've mentioned in my slide, the successful of this project really greatly depends on the participation and acceptance by the community, and therefore we have to continuously engage with the community. All right, I think throughout the project, we have to really have a good communication with the community. And in fact, in Malaysia, I just would like to add on that we have a phone number that the public may contact if they have any. It is a hotline number if the public have any questions about Wolbachia. I think that's all from me.
Do you have special communicator for that?
Yeah. There's a hotline that the community can contact whenever they would like to ask about anything about Wolbachia.
Okay.
Prof. Sri, can I add to that?
Yes, please.
Yeah, so like Sakunthala already mentioned that
same as in Sri Lanka. Yeah, same as in Sri Lanka, and during that releasing period, there's a hotline to answer that community.
Okay.
Yeah, so to add on that, actually in WMP, we have what we call PAM, or Public Acceptance Module, with several indicators and also with phone number, and even in our MRC, or Mosquito Release Act, Mosquito Release Container, we have all the number there, also who to contact on what, and not only before, but also during and after the project ends. So we do really care about the community acceptance, and usually we spend 1 year at the beginning just to get community acceptance and engagement. So we have all of those measures, and also risk mitigation. Thank you.
Okay, thank you.
All right. Thank you very much. I think we have done all the questions. Sri, do you see any other questions there?
No, maybe there is any question from the audience. Maybe.
Yes. Yeah, if you have any questions from the audience, you can unmute yourself and please ask your question so that the two speakers can answer, or anybody else can answer. And by the way, Dr. Claudia, you have another invitation to go to Pakistan now.
Yeah, actually, we have several visits from Pakistan to our Ho Chi Minh City office, and we want to collaborate. We just need the funder. So maybe by this, I can also call upon the public-private sector engagement. This dengue is not only government responsibility. Dengue is responsibility of all of us, including the private sector. So cross-sectors are really needed, because otherwise the number of hospitalization, number of absentees can affect the work as well.
Okay,
so,
yes, sorry, see?
No, I want to ask to Dr. Claudia, where is the office of the Regional Asia Wolbachia program? In Vietnam or?
Yes, it's in Ho Chi Minh City. Yeah, but now because of COVID situation, our office is from home, wherever the home is.
Okay, thank you. Thank you for all speakers.
Yeah, thank you very much.